and I'm a board-certified general surgeon here in South Texas Surgical Group in New Braunfels. I grew up in Nacogdoches, Texas. I went to high school there at Nacogdoches High School. I did my undergraduate at Ouachita Baptist University in Arkadelphia, Arkansas on a swimming scholarship. I trained at the University of Tennessee Medical Center in Knoxville, Tennessee, and then moved down here to South Texas to treat the patients in New Braunfels and surrounding communities. So I decided to become a doctor. At least I notified my family when I was really young. I decided that general surgery was for me when I had the shadowing opportunity in the 8th grade to go shadow a friend of my father's who was a general surgeon. I was able to witness firsthand the effect and the impact that you could have on somebody's life in the immediate acute care setting, and it really drew me into the profession, and that is something that I've carried all the way through residency and here in South Texas where I treat patients. I care about patients, I care about their outcomes. So here at South Texas Surgical Group, we primarily treat adult patients. The most common things that we see here in the office is generally, gallbladders, hernias, bread and butter general surgery, breast, thyroid. We get quite a broad scope of patients that get sent to us for evaluation and treatment. And so usually when people ask, what type of patients do you treat, I tell them that I take all comers, and usually we sort out the issues and get patients taken care of. As a broad scope general surgeon, I tell my patients that I primarily focus on MIS, minimally invasive techniques, which can be the Da Vinci robot, it could be standard laparoscopy. We still do open surgeries whenever the time calls for it, but generally we try to stick to being able to do really big, life-changing operations through small incisions, and so that's the goal, to get the patients taken care of in a manner that they tend to heal better, have shorter recovery times. Their pain profile is much improved with smaller incisions. Something that I'd like patients to know about me is that I consider myself a very patient-centered physician. I like taking care of patients. I like talking to patients. I like really trying to understand them and where they're coming from. And their story is important to me, and their outcome is very important to me. And I tell them that, whenever somebody comes to see me for consultation, I lay out the risks, benefits, and alternatives to surgery. We talk about their options, and we talk about the surgical plan, or not. And sometimes there's times where surgery is really not an option. We talk about other things that we can possibly do. I want patients to feel that they have taken direct part in their care, and that we have a goal-centered outcome that we're going to achieve. I absolutely love New Braunfels. I love South Texas. I love the surrounding communities. Me and my family really enjoy our time here. This community is important to us, and we're hoping to stay here for a really long time.